It's the place you go if you're sick or injured, the hospital. But hospital stays can actually put you at risk if the proper precautions are not taken by the medical staff. Believe it or not, the most common dangers aren't in operating rooms, they're in prescription bottles. Medication management is an enormous part of patient safety, and hospitals like Provena St. Joseph Medical Center are making it a top priority.
Drugs carry a risk due to the effects it provides. In a hospital setting, your normal situation at home differs. Within the hospital, we're treating different conditions. And so you're adding different medications to your medications that you normally take. Because of that, we have to make sure that the drug interactions are accounted for, that the dosing that you normally take at home may differ because you're in a different environment. In order for us, pharmacy, to provide the correct doses for the indication, we look at the patient's weight and their kidney functions and their liver functions to make sure that the dose is appropriate.
One medication issue hospitals can't control is drug shortages. According to the FDA, there are literally hundreds of life-saving medications on back order. For tens of thousands of patients who can't wait for treatment, hospital pharmacists need to find suitable substitutions. It's a challenge that requires thoughtful consideration for each and every patient.
As different manufacturing companies have closed their businesses, the demand of these drugs are higher, with the supply being lower. And so all these hospitals around the world are looking for this medication. Because of that demand, we're having shortages. So when we have a situation where the drugs are not available due to the shortages, we contact the physicians first, and then we discuss what are different options that we have, what medications are available.
Hospitals must also apply antibiotic stewardship. Overuse of antibiotics has led to drug-resistant superbugs like MRSA. To curb this trend, hospital pharmacists need to use antibiotics strategically, prescribing the right drug for the right infection.
Overuse of these antibiotics are creating superorganisms. Because these organisms are consistently being exposed to the antibiotics, they become resistant. When they become resistant, what happens? There is no cure, and that is our concern. So we want to try to eliminate that, so that if the patient is improving in the process of the infection, do we decrease, do we strategically change the antibiotics to better combat the affected organism? In that process is called stewardship. The better we provide that services to our patients, the shorter the stay in the hospital.
Although top hospitals take great measures to ensure the safety of all those under their care, experts say much of the responsibility lies with patients and their families. Patients must inform doctors of all medications and supplements they take and should feel free to ask questions about any drugs given to them during a hospital stay.
All these subject matters about patient safety, medication errors, antibiotic stewardship, drug shortages, all lead to how does one get safe medicine in a hospital setting. And it has to do with communication from not just the patients, not just from the pharmacy, but from everyone.
Prescription drugs can save lives, but they need to be used safely. Proper medication management is an integral part of giving patients the quality care they need and deserve. Provena St. Joseph Medical Center puts patients first. Located in Joliet, Illinois, this top hospital boasts some of the most advanced technology and skilled medical professionals in the region. Provena St. Joseph Medical Center is nationally recognized for its world-class Neuroscience Institute, cardiac program, women's and children's, orthopedics, and Level 2 trauma center. The hospital has also evolved into a regional referral center, providing tertiary services to the community's most seriously ill patients. These standout programs highlight the hospital's unwavering commitment to patient safety.
At Provena St. Joe's Medical Center, we're committed to continual diligence when it comes to patient safety and reinforcing a positive culture of safety. And that means more than compliance with quality and safety protocols, although the basics such as hand washing and patient identification require strict adherence. We're focused on elevating the standard of care through continual improvement and enhancement in communication amongst our medical professionals, such as effective handoff communication, as well as educating and providing clear communication with our patients and their families, such as clear discharge instructions and the reinforcement of medication compliance. We take our responsibility as healthcare providers very seriously and continually evaluate processes, are ever vigilant about providing the highest quality of care possible in the safest environment.
For the medical professionals at Provena St. Joseph Medical Center, patient safety is always on their minds. They take the extra steps needed to give patients the best of care. Their best safeguard? Communication.
Communication is incredibly important in patient safety. It's important that all of the care providers are on the same page so that we can communicate the plan of care and prevent any serious medical errors or adverse events.
For more than a century, Provena St. Joseph Medical Center has given the highest quality care to the Joliet community. It's this history of care and patient safety that will carry the hospital and its community into the future.
To enhance quality and safety, we allocate resources to review the condition and improve our physical environment. Then we build and we renovate accordingly. We also maintain and purchase new equipment to ensure the newest technologies are available and scientific advances are utilized to benefit our patients.
For more information about our hospital, visit us online at provena.org/St. Joe's.